All right, I just want to talk about my experiences of depression. And I basically want to convey to people how tough it is. But probably my primary point of putting this online is to get through to whether it's parents or people offering care support, to be aware how tough this is and to always be caring and supportive. And don't think for a second it's something you could just snap out of by, it doesn't happen like that. Depression is real and it's extremely tough. And yes, there are plenty of people who probably have difficulty understanding how tough depression is. And let me just try and explain or enlighten you to some degree. Look, we all understand what a hangover is like. A hangover, when you have a hangover, basically you're low mood, you're pretty flat, you're not feeling well, you're pretty lethargic, you're just not there, you're feeling lousy, you're feeling awful, you're pretty much only ready for the bed or good for the bed. That's not a nice experience. But trust me, if you want to have severe depression, intensify that experience of a hangover, intensify it by 100. Trust me, if you intensify it by 100, you're coming to understand how tough depression is. Because trust me, if you think you have a low mood or a flat mood and you're lethargic with a hangover, trust me, with severe depression, trust me, it is a huge, another level altogether. Well, to a factor of 100, if not more. It is extremely intense. For me, when I've had severe depression, I used to experience it in my late teens and early 20s for long, long periods of time. It is extremely intense. To call it a depressive gloom, is to put it lightly. It is intensely depressive, deep, deep, deep depressive gloom. And trust me, it is, for me, when I experienced, basically, my brain, although the mood was extremely and intensely flat and low, my brain basically, in a sense, that it ceased to function early in a cognitive sense, in a thinking sense. Like all thought pretty much shut down. The depressive gloom was that intense that all I personally ever thought about was how was I going to get out of this situation, i.e. suicide. It was extremely intense. It was a miserable experience, trust me, miserable. But the only reason I put this online is I have to get through to parents, most especially, to stop getting on your son or daughter's case if they're suffering from depression. Trust me, you don't know how tough this is. It's not something that you could just snap out of. It is tough. It's extremely tough. Like when I was going through it in my early 20s, I did not work at all. I could not work at all. I dropped out of college. I gave up that malarkey. It's a waste. Don't think, firstly, on that. Trust me, don't be getting on your son or daughter's case about college or career, all that crap. Trust me, that is not the point of life, You need care and support at times. You need a supportive network around you at times. You need people to help you get better, because trust me, when you're going through this, you have to be supportive. If you're not, you're going to make things a lot, lot worse. Always be supportive and caring. You have to be. Don't be getting on their case. Like college can be put off for a year or two, can be put at another time. The best thing you can do is to just encourage them to engage in therapy. Look, there's plenty of help and support out there. Therapy was great for me. A problem shared is a problem halved. Like I started seeing a psychiatrist and it helped me a lot, a therapist as well, and it really did help me a lot. There are support groups out there in the community as well, depression support groups. They are extremely good. You meet people who are going through it. They have the empathy, they have the compassion. Trust me, at a very good level. They're really supportive. Look them up. They're great. But just always be caring and compassionate, because trust me, it is extremely tough. And trust me, you have to do it. Otherwise, you're going to make the situation a lot, lot worse.